Okay, this is a 4-year-old boy who suffers since 3 days of a sore throat with fever, 100 degrees Fahrenheit, headache, pains in the limbs, and is very weak and can hardly swallow. On examination, I find a bright red inflammation of the throat, severely swollen tonsils, then petechial bleedings on the palatal arch. The tongue is also bright red and the cervical lymph nodes are very severely swollen and painful. And at the look at the skin, I find a typical rash. What's the diagnosis? Scarlet fever, I hear. Yes, it is a scarlet fever patient. Now, checklist, ear, nose, throat. I have written symptoms: mouth odor, dry mouth, then underlined thirst, swallowing worse, food and drink, cold things better, cold in general worse, warmly from wrapping up better, aversion to open air, and open air worse, movement worse, physical effort worse, lying position better, standing worse, pressure external worse. As usual, I just use the polar symptoms because we have so many. You see, we have 12 polar symptoms. We do not enter scarlet fever because this is a possibility we have in the repertory. There are some diseases as diagnosis in it. We can enter it if we do not have enough symptoms, but if we have enough, we would not use this because it's not quite correct. Now you see we have quite many remedies covering all symptoms. It's 2, 4, 6, 8, 10, 11. And we have very prominent bryonia. Second place, mercurius, then natrium muriaticum. Third place, so this is actually what is in question for him. All the others have quite a number of contraindications. Now, if we include scarlet fever rash, which is a symptom, where are we? Here. Only bryonia and mercurius solubilis remain. So natrium muriaticum falls out. In the materia medica comparison, we find in bryonia dry tongue, sticking pain on swallowing, pain in throat, quickly prostrates, shuns all motion, when being moved, pain everywhere. And for mercurius, we have redness and swelling of soft palate, tonsil and oral cavity, difficult deglutition, burning in throat, painful dryness of throat, with mouth full of saliva, suppuration of tonsils, lymphatic glands of throat hard and large. Well, now we are quite in a clinch, aren't we? See, we have a very clearly high polarity difference and a very much lower polarity difference in mercurius. So, and we have a materia medica comparison that would fit mercurius rather better than bryonia. What do we do? What would you do? Yes, I would take bryonia, but it's just because I have made the experience that the polarity difference is so important. So I took, in this case, bryonia. 200C. In the following night, he sleeps well, but still has slight fever. Next morning, 12 hours later, throat pain and headache have gone. And at the follow-up consultations a week later, all the previous findings are normalized and he's completely healthy again. So, what do we learn from this case? Polarity difference is more important than materia medica comparison. That is one point. Where are we? Another warning is that scarlet fever is normally not a very dangerous disease, but there are some variations of it that are extremely dangerous. So if you treat scarlet fever, you must be sure of yourself. Be very careful with these patients.